Why are cancer treatments, such as chemotherapy and radiation, often effective in the short-medium term only? Causes versus symptoms. The first question every cancer patient should ask himself or herself is whether cancer is a symptom or the cause. The very fact that there are cancers with very high recurrence rates may suggest that cancer is a symptom. It is quite understandable that cancer is a symptom, but the underlying causes remain unclear. It is somewhat known that genetics have a role, but it cannot explain most cancers. Researches now focus on epigenetics, the environmental expression on the human genes. What do these four groups of diseases have in common? Allergies, chronic inflammations, cancer, autoimmune diseases. Conclusion: each group of diseases represents a different type of immune system long-term malfunctioning. What is the logic of treating symptoms if the causes are unclear? Opportunities. By removing the tumor surgically, with all the love and care of family and friends, along with changes in lifestyle, there is a hope to eliminate the causes and gain recovery. Disadvantages. Treating symptoms is like extinguishing fire without removing the combustion material that caused the ignition in the first place. The problem is that a new fire could burst at any moment. The violent surgeries and treatments often leave the patient without joy and happiness. In such a situation, it is challenging to recover in the long run. The mental enhancement is based in part on the placebo effect that requires a profound belief and does not work on everyone equally. Why scientists still did not achieve a significant breakthrough in the field of cancer. The logical explanation is that the modern lifestyle is unhealthy in the first place. Anxiety and stress, combined with poor nutrition and environmental pollutions, are conditions that no drug or invasive treatment can cure. So the conclusion is that there is nothing to do? Certainly not, there's a lot to do. What is the life force energy? Qi in Chinese culture. The life force energy is all around us, and in every organ of our body. Without the life force energy, we will die. Interference of life force energy flow can result in physical imbalance and illness. The concept of life force energy is widespread in the Far East. Chinese acupuncture and martial arts are based on controlling this energy, but in Western culture, it is difficult to accept this abstract concept. What are the two leading medical approaches today for cancer treatments? Conventional modern medicine. Advocating surgical removal of the cancerous tumor, often radiation therapy and chemotherapy to ensure kill of all cancerous cells and preventing metastatic proliferation. In recent years, personalized therapies have evolved as well as biological therapies whose role is to support the compromised immune system. Self-healing medicine, perceived as alternative medicine. Advocating the elimination of mental traumas that result in a decrease in life force energy. Particularly healthy lifestyle, both mental and physical. Meticulous varied unprocessed nutrition and sustained detoxification. The 4 Life Phases Model. By Dr. Nadder Butto. All the energetic processes in nature, from the single cell to the entire universe, are characterized by the dynamic energy flow. Consists of 4 phases. Stimulation, expansion, contraction, relaxation. Prominent examples. Mitosis, cell division, consists of 4 phases. Prophase, metaphase, anaphase, telophase. Body organs, respiratory system and heartbeat. Each has 4 phases. Seasons, spring, summer, fall, winter. Life cycle, birth, maturity, old age, death. Applies also for stars. All matter has 4 phases: gas, liquid, plasma, solid. Matter and energy have dual properties. What makes cancer disease different from the other 3 groups? Allergies, chronic inflammations, cancer, autoimmune diseases. The answer is that cancer reflects blockage in the contraction phase, 3rd in the life phases model, and is the state in which the body's energy in general and the specific organ is the lowest among the 4. It is illustrated in a diagram on the next slide. The integrated model of long-term immunodeficiency diseases. Interference with the energetic flow of the contraction phase, gray color, shows cancer has two developmental pathways: direct and indirect. The 4 life phase integrated model regarding cancer. The direct trajectory of a sharp and sudden decrease in life force energy, usually accompanied by significant mental trauma. Often unconsciously. Such a situation may characterize younger people. Its effect may be particularly acute. The secondary pathway is a pathway of gradual deterioration or benign tumors that gradually become cancerous due to a continuous decrease in life force energy. This pathway is more characteristic of older people. Their cancer develops more slowly and is not particularly violent. The location is never accidental. Cancer hits the weakest spot on the energetic level. Cancer, all types, underlying causes are always a dynamic combination of these two primary elements: body, mind and spirit. Lifestyle versus genetics. An unhealthy lifestyle, mental and physical, is the leading cause of all types of cancer. 80% or more. Genetics explains only a small part of the failures. 20% or less. Physical body. Unhealthy lifestyle reflected in improper nutrition, high body toxicity, low physical activities, and exposure to the sun. Lack of sleep manifests itself in poor flow of body fluids, blood, lymph, bile, gut flora imbalance and parasite overgrowth, which causes a heavy load on the immune system. Mind and spirit. Patients whose cancer broke out at an early age must place particular emphasis on the mental side. In contrast, patients whose disease broke out at an older age should emphasize improving lifestyle and nutrition. Why is self-healing, alternative, cancer treatment challenging right now? The social pressure that raises profound questions makes it difficult for the patient to go against the flow. Turning to alternative medicine, self-healing, usually occurs after the failure of conventional medicine. Although there are specialized self-healing cancer clinics, a good deal of care is placed on the patient himself and his environment. Are you confused by now? The choice is one of two complicated options. Conventional modern medicine that treats mainly the symptoms with aggressive medication and surgical procedures, disregarding the energetic properties we all possess. Life force. Self-healing medicine, contrary to mainstream, and raises questions and social pressure. Besides, most of the therapeutic and mental burden is on the patient and his or her environment. The decision which type of medicine to choose is often a default decision. A more profound decision requires brainstorming, disturbing questions. Which of the two methods is preferable? The answer depends on the patient's confidence in the method, the attending physician and, of course, his worldview. Can the two approaches be combined? The methods can be combined, although it is doubtful that you will receive such recommendations from conventional doctors. It is worth noting that aggressive treatments, such as chemotherapy and radiation, contradict self-healing. What does it mean if I am a recurrent cancer patient? A state of recurrence of the cancer is an indication of deficient life force energy. Without mental and spiritual treatment to restore life force energy, it is challenging to achieve recovery. Summary. The very fact that there are cancers with very high recurrence rates may suggest that cancer is a symptom. If we understand the underlying causes of allergies, chronic inflammations, cancer, and autoimmune diseases in depth, maybe we can also understand how to cure cancer. What makes cancer disease different from the other three groups? Is that cancer reflects blockage in the contraction phase, third in the life phases model, and is the state in which the body's energy in general and the specific organ is the lowest. The theme of self-healing medicine involves many philosophical and practical issues. The full article is available on the sfhealing.com website. Philosophy of Medicine chapter. Thank you for watching this video.